Major changes to the cost of a life-saving medication. The three largest providers of insulin drastically cutting prices for users. News 8's Joe McCoy joins us in studio to tell us how this will benefit millions in the U.S. Good evening, Joe.
Good evening, John. 8.5 million Americans use insulin. Earlier this year, President Biden capping insulin costs for seniors on Medicare at $35. Now, the private sector is following suit, setting their cap at the same price.
$35.
A sigh of relief for insulin users.
Patients are honestly excited.
Eli Lilly, Novo Nordisk, and Sanofi supply 90% of the U.S. insulin market, all three instating a $35 monthly cap.
We are thrilled to see the private sector responding to the president's call to action and seeing all three major insulin manufacturers dramatically lowering the price for insulin.
Christine Young is a White House health policy expert.
Insulin costs just $10 a vial to make. It's a drug that's been around for 100 years, and yet we have seen a pattern of drug makers driving their prices up higher and higher, and we're glad to see that turning around and coming to an end.
These price changes will be felt and welcome in the Quad Cities.
Honestly, so excited. It's kind of like, yes, finally, it's happening.
Diabetes specialist Danita Harrison works at a clinic in Davenport.
Insulin, is a miracle drug for people with diabetes because it saves lives every day. And without this cap, people will actually pay $700 for a box of insulin that may not even last them a month, and they may need 2 or 3 boxes.
According to the American Diabetes Association, average price of insulin nearly tripled between 2002 and 2013, and that trend has only continued.
No one should lay in bed at night wondering how they're going to afford life-saving medication for them or their children. It's completely unacceptable in the wealthiest country on earth that we see this sort of inequitable access to critical medications.
President Biden calling on Congress to apply the cap to all private insurance companies. As far as when these caps are going to take effect, it varies per company. For Eli Lilly, who was the first company to enact a cap on March 1st, the $35 a month will begin in May. For Novo Nordisk and Sanofi, their cap will begin January 1st. Back to you.
Alrighty, thanks, Joe. Diabetes is the fastest growing chronic disease in the world, and in 2019 was the 7th leading cause of death in the U.S., according to the American Diabetes Association.